Blood, a fluid so vital, so essential to life, that the mere sight of it makes some people faint. But for you as a first responder, dealing with blood is just a part of the job, an everyday occurrence that you may have taken for granted. Even if you're not a first responder, you could be the first person to respond to a fellow employee's accident involving blood. The Federal Occupational Safety and Health Administration, or OSHA, has issued a standard that can protect you at work. It explains ways to substantially reduce or even eliminate your risk of contracting a bloodborne disease on the job. Hepatitis B virus, or HBV, causes serious liver disease. About half of the people infected with hepatitis B have no symptoms. Those with symptoms may experience jaundice, fatigue, abdominal pain, loss of appetite, occasional nausea, or vomiting. Most people infected by HBV recover and clear the infection, but about 10% become chronically infected for life. Each year, more than 5,000 people die from related chronic liver disease and liver cancer linked to hepatitis B. The hepatitis B virus poses a greater risk than either hepatitis C or HIV because it is more easily transmitted. But fortunately, hepatitis B can be prevented by taking the hepatitis B vaccine. Hepatitis C virus, or HCV, causes a serious liver disease known as hepatitis C viral infection. This liver disease may cause symptoms similar to hepatitis B, but there are important differences between hepatitis B and hepatitis C. While 85% of people infected with HCV have chronic infections, only about 10% of those infected with HBV are chronically infected. In fact, the Centers for Disease Control and Prevention, or the CDC, reports about 3 million people in the United States are chronically infected with the hepatitis C virus, while about 1.25 million are chronically infected with the hepatitis B virus. And remember, many people infected with these two viruses have no symptoms at all. That includes about half of those infected with HBV and up to 3/4 of the people infected by HCV. In fact, people who are chronically infected with hepatitis C may have no symptoms for up to 30 years. Yet during that time, the infection may be slowly damaging the liver. Hepatitis C is the leading indicator for liver transplants. Each year, up to 10,000 people die from hepatitis C-related chronic liver disease. HIV, or the human immunodeficiency virus, attacks a person's immune system and causes it to break down. The clinical picture of HIV infection differs widely from person to person. A number of those infected remain apparently healthy for many years. The infected person becomes seriously ill when the immune system loses its ability to fight infections. Some infected persons go on to develop AIDS. As many as 900,000 people in the United States are infected with HIV, according to the CDC. The number of HIV-infected people who develop serious illness and who die from AIDS has decreased thanks to the success of recent treatments. People with HIV now live longer and healthier lives, but yet there is no preventive vaccine against HIV. As you can see, HBV, HCV, and HIV are very different viruses, yet the way they are transmitted in the workplace is essentially the same. As a first responder, it is imperative that you're aware of the body fluids which transmit the diseases. HBV, HCV, and HIV may be present in blood or other potentially infectious materials, including body fluids such as semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, peritoneal fluid, pericardial fluid, amniotic fluid, and any other body fluids visibly contaminated with blood. Unfixed tissue or organs other than intact skin from living or dead humans. You can be exposed to bloodborne pathogens at work if a contaminated sharp object punctures your skin. Sharps include not only needles, but also broken glass, anything that can pierce, puncture, or cut your skin. You can also be exposed to these viruses if blood or other potentially infectious material contacts your broken skin or splashes the mucous membranes of your mouth, eyes, or nose. Open cuts, skin abrasions, and even dermatitis and acne provide entryways. Bloodborne diseases also can be transmitted indirectly. This may happen if you touch an object or surface contaminated with blood or other infectious material, and then transfer the infectious material to your mouth, eyes, nose, or broken skin. Sound far-fetched? Not at all. Contaminated environmental surfaces can pose a risk for spreading HBV. Believe it or not, HBV can survive on environmental surfaces, dried and at room temperatures, for at least a week. Research shows that safety precautions decrease the number of exposures on the job. Your exposure control plan details these safety measures. It identifies which employees are covered by the OSHA Bloodborne Pathogen Standard. You are covered by the standard if it is reasonably anticipated that you could be exposed to blood or other potentially infectious materials as a result of performing your job duties. The exposure control plan describes what measures will be taken to minimize your risk of exposure and what procedures to follow if there is an exposure incident. The plan also helps first responders identify and evaluate safer medical devices, such as protective sharps. There are a number of different approaches to reducing your risk of exposure to bloodborne pathogens on the job. These include engineering controls, employee work practices, personal protective equipment, housekeeping, and administration of the Hepatitis B vaccine. Used together, they're like having a series of 5 protective barriers or shields against infection. Most approaches to infection control are based on a concept called standard precautions. It includes measures or universal precautions to specifically prevent exposure to bloodborne pathogens. Many people can carry bloodborne diseases, yet have no visible signs or symptoms and no knowledge of the disease. That's why standard precautions requires you to treat all blood, body fluids, excretions and secretions except sweat, plus non-intact skin and mucous membranes, as if they were infected with some pathogen. If you're not a qualified first responder, stay with the victim until help arrives, and make sure you protect yourself against exposure to blood or other potentially infectious body fluids. In some circumstances, it may be difficult to tell what type of fluid you're faced with. For example, with this injured worker covered in industrial fluid, it might be difficult to tell what's blood and what is not. When in doubt, treat all fluids as potentially infectious. Engineering controls are your first protective barrier. These controls isolate or remove the bloodborne pathogen hazard from the workplace. Included are controls such as sharps with engineered protection devices and sharps disposal containers. Yet the effectiveness of these engineering controls sometimes depends on what you do. For example, a sharps disposal container provides no protection if you discard used needles elsewhere. This brings us to your next protective barrier. Work practices are specific procedures you must follow on the job to reduce your exposure to blood or other potentially infectious materials. Good work practices help prevent needle sticks, one of the most common ways bloodborne diseases are transmitted on the job. To prevent needle sticks, use a safe needle device or needleless system whenever appropriate. For instance, needleless IV setups are available, as are needles with engineered sharps protection for drawing blood or giving injections. Also, do not bend, recap, shear, or break contaminated needles or other sharps. Discard contaminated sharps immediately after using in an appropriate puncture-resistant, leak-proof container. Another effective work practice control is also one of the most basic: wash your hands. If infectious material does get on your hands, the sooner you wash it off, the less your chance of becoming infected. Hand washing also keeps you from transferring contamination to other areas of your body or the environment. If your hands are not visibly soiled, or if a sink is not readily available, the Centers for Disease Control and Prevention recommend use of waterless alcohol antiseptic hand rubs. If visibly soiled with blood or other material, you must wash your hands with non-abrasive soap and running water for at least 15 seconds, even if you used a waterless antiseptic cleanser. Here are some controls based on personal hygiene that must also be followed. When performing procedures involving blood or other potentially infectious materials, you must minimize splashing, spraying, spattering, and generation of droplets. Do not eat, drink, smoke, apply cosmetics or lip balms, or handle contact lenses where there is a reasonable likelihood of occupational exposure. It is okay to apply hand cream as long as you thoroughly wash your hands first, but stay away from petroleum-based lubricants which may eat through latex gloves. Don't keep food and drink in refrigerators, freezers, shelves, cabinets, or on countertops or bench tops where blood or other potentially infectious materials are present. Personal protective equipment, or PPE, is your third barrier. Equipment that protects you from contact with blood or other potentially infectious materials may include gloves, gowns, face shields, protective eyewear and masks, and resuscitation bags or other ventilation devices. Evaluate the exposure risk and dress appropriately. Appropriate means that under normal conditions, protective equipment must not let blood or other potentially infectious materials contact your clothing, skin, or mucous membranes. Your employer will provide personal protective equipment. In addition, your employer will maintain, replace, or dispose of any protective equipment at no cost to you. Make sure you know how to use the equipment properly. It must be appropriate for the task, be a good fit, and be free of physical flaws that could compromise safety. You must use appropriate protective equipment each time you perform a task. If, when wearing equipment, it becomes penetrated by blood or other potentially infectious materials, remove it as soon as possible. After you finish with the emergency, remove all protective equipment and place in a designated area or container for washing, decontamination, or disposal. Then wash your hands. Two types of personal protective equipment deserve special mention. The first is emergency ventilation devices and pocket masks designed to isolate you from contact with the victim's body fluids. Avoid unprotected mouth-to-mouth resuscitation. The patient may have blood or other infectious materials in the mouth, or may expel them during resuscitation. The second type of equipment is gloves, the most widely used and basic form of personal protective equipment. Treat all blood as infectious and always wear gloves. Disposable single-use gloves that are low-protein and powder-free are used for first aid, and heavy-duty utility gloves for housekeeping. Since gloves can be torn or punctured by sharps, cover any hand cuts with bandages before being gloved. Replace disposable single-use gloves if they become contaminated, or if they are torn, punctured, or no longer offer barrier protection. Never wash or decontaminate this type of glove for reuse. Utility gloves may be decontaminated or reused if they are not cracked, peeling, torn, punctured, and if they otherwise offer barrier protection. Finally, be careful when removing gloves. While both hands are gloved, peel one glove off from top to bottom and hold it in the gloved hand. With the exposed hand, peel the second glove from the top, tucking the first glove inside the second. Dispose of the entire bundle promptly. Then wash your hands, a practice critical for your protection. One of the best ways to protect yourself from HBV infection is to roll up your sleeve. If your job puts you at risk of exposure to infectious materials, your employer will make the hepatitis B vaccination available to you at no cost. The vaccines used today are safe and effective at protecting you from getting HBV infection if the series is completed. The fifth and final protective barrier is housekeeping. Good housekeeping protects every first responder and is every worker's responsibility. For example, a contaminated sharp is carelessly discarded. A coworker comes along and sits on the sharp, exposing himself to a possible disease. Your exposure control plan lists specific methods and regular schedules for cleaning environmental surfaces possibly contaminated with potentially infectious materials. Here are some general rules. All equipment and environmental working surfaces must be cleaned and decontaminated with an appropriate disinfectant as soon as possible after contact with blood or other potentially infectious materials. Protective coverings on equipment or surfaces must also be replaced when contaminated. Use a broom and dustpan or tongs to pick up broken glass, not your hands. Dispose of contaminated sharps and other potentially infectious waste in designated containers. Containers should be easily accessible. Do not allow them to overfill. Handle contaminated laundry as little as possible and with minimal agitation. Place in labeled or color-coded containers at point of use without sorting or rinsing. Use leak-proof bags to transport wet laundry. Wear gloves and other appropriate personal protective equipment if you work with contaminated laundry. If you're exposed to blood, wash the exposed skin or needle stick with soap and running water. Flush exposed mucous membranes with large amounts of water. Then, report the incident to your supervisor as soon as possible so the post-exposure evaluation, counseling, and any necessary treatment can begin right away. Report and document all sharps injuries as directed in your exposure control plan. Evaluate any safety device used and how the injury could have been prevented if possible. Be on the lookout for fluorescent orange-red labels, red bags, and containers. They warn you that contents may contain blood or other potentially infectious materials. It takes a certain fortitude and dedication to work as a first responder. No, you don't faint at the sight of blood. Neither do you shrink from facing new challenges. Protecting yourself from bloodborne disease on the job requires knowing the facts and taking sensible precautions. Working together with your employer, you can do it. As a first responder, you can be confident in your ability to care safely for the well-being of others and yourself.